हेलो स्टूडेंट्स, आज हम रिकॉल करेंगे डर्मेटोलॉजी INICET 2021 PYQs। फर्स्ट क्वेश्चन है, एन एडल्ट मेल विद a history of visiting forests recently developed the following reason. Which of the following is not a differential diagnosis? A. Cutaneous anthrax, B. Cancer forest disease, C. Scrub typhus, D. Healing brown recluse spider bite। इसका आंसर है बी, कैसनोर फॉरेस्ट डिसीज। Castor forest disease, the image shown black S-char. Castor forest disease does not present with S-char. Castor forest disease causes KFD virus. Symptoms क्या होते हैं इसके? Present with abrupt onset of fever, headache, conjunctivitis, myalgia, and severe prostration. Some cases may develop hemorrhages in the skin, mucosa, and viscera. Question number second है, the most specific and typical sign of juvenile dermatomyositis in a 17-year-old patient are A. Photosensitive rash, B. Nail bed capillary changes, C. Malar rash, D. Gautrans papules। इसका आंसर है D. Gautrans papules। Gautrans papules are the typical and specific sign of juvenile dermatomyositis. These are violaceous, lichenoid, inflammatory, flat-topped papules on proximal interphalangeal joints, distal and interphalangeal joints, and metacarpopharyngeal joints. Question number 3. A patient comes with painful vesicles on their genitals. The histopathology finding will show A. Zank cells, B. molluscum bodies, C. Patterson bodies, D. Cells with a clear halo around the nucleus। इसका आंसर है A. Zank cells। Zank cells, the given image shows a cluster of vesicles on erythematous base suggesting genital herpes. On microscopy, Zank cells or multinucleated giant cells with intranuclear inclusion bodies are seen with when stained with Giemsa stain. The herpes lesions are thin-walled, umbilicated vesicles, the roof of which break down, leaving tiny superficial ulcers. They heal without scarring. Question number 4. A child comes with patchy hair loss, itching and scaling on the scalp as shown. The next best step is A. KOH mount, B. gram staining, C. biopsy, D. slit skin smear। इसका आंसर है A. KOH mount। KOH mount, the given image shows a well-demarcated scaly patch in which hair shafts are broken off with just above the skin, resulting in alopecia indicating tinea capitis. KOH mount is useful for this condition. Question number 5. A patient presents with lesion as shown. The diagnosis is A. Borderline leprosy, B. Borderline lepromatous leprosy, C. Lepromatous leprosy, D. Histioid leprosy। इसका आंसर है A. Borderline leprosy। Borderline leprosy, the given image shows hyperpigmented plaques with annular Swiss cheese, inverted, saucer or punched out appearance indicating borderline leprosy. Mid-borderline leprosy, it is the most unstable form of leprosy. It can upgrade or downgrade either to borderline tuberculoid or borderline lepromatous depending on the immune status of the patient. स्किन लीजन कैसे होते हैं? इसके पॉलीमॉर्फिक होते हैं, जोग्राफिक मैप लाइक अपीयरेंस, इन्वर्टर सॉसर शेप लीजन, inner punched out Swiss cheese appearance, and sloping outwards. Histopathology tuberculoid granulomas are less prominent. Gran zone is more prominent. Transverse section of the nerve shows Cottonian appearance. Question number 6. A child presented with itchy plaque over the neck and bilateral popliteal and cubital fossa. What could be the diagnosis? A. Atopic dermatitis, B. Dermatitis herpetiformis, C. Pemphigus vegetans, D. Psoriasis। इसका आंसर है एटोपिक डर्मेटाइटिस ए। Atopic dermatitis, the given clinical features and the image suggest the diagnosis of atopic dermatitis. It is the cutaneous expression of the atopic state. It is associated with a family history of asthma, allergic rhinitis, or eczema. The cardinal symptom is itching along with the atopic dermatitis. It is classified as an endogenous eczema triggered by exogenous agents. Question number 7. A female comes with unilateral lesions as shown in the image. She also has leukotrichia. The diagnosis is likely to be A. Segmental vitiligo, B. Focal vitiligo, C. Piebaldism, D. Nevus depigmentosus. इसका आंसर है A. Segmental vitiligo. Segmental vitiligo, the given image shows unilateral localized depigmented macules. This feature and history of leukotrichia suggest a diagnosis of segmental vitiligo. Question number 8. A rose gardener following prick injury develops the following skin changes. What is the causative agent? A. Histoplasma, B. Sporothrix scancai, C. Sarcoptes scabi, D. Paracoccoidosis marnefi. इसका आंसर है बी स्पोरोथ्रिक स्कैनकाई. Sporothrix scancai, the given clinical picture shown erythematous nodules spread along lymphatic channel is of sporotrichosis. Question number 9. Patient presented with these vesicular lesions distributed on a single dermatome and also complains of pain over the region. Which of the following is the most probable cause? A. HIV, B. Herpes simplex, C. Lymphoangioma, D. Herpes zoster. इसका आंसर है डी herpes zoster. Herpes zoster, the given clinical picture is of shingles or herpes zoster. It occurs in secondary infection with varicella zoster virus. Reactivation of latent varicella zoster from dorsal root ganglion after primary infection. Chickenpox characteristics, unilateral lesion, dermatomal involvement, most common T3 to L3 spinal segment, mucous membrane within the dermatome is affected, painful. Grouped vesicles over red base triggers for herpes zoster include emotional stress, use of medication like immunosuppressants, acute or chronic illness exposure to the virus, presence of a malignancy complication, post-herpetic neuralgia, treatment amitriptyline, pregabalin, gabapentin, antiviral for painful zoster, high-dose acyclovir started as early as possible, 800 mg 5 times per day for a week. Question number 10. A 68-year-old with tense itchy blister that ruptured after a few days to leave a hemorrhagic crust. Image shown. Diagnosis: A. Bullous pemphigoid, B. Pemphigus vulgaris, C. IgA pemphigoid, D. Dermatitis herpetiformis. इसका आंसर है A. Bullous pemphigoid. Bullous pemphigoid history of tense itchy blisters which settle down after a while is consistent with the diagnosis of bullous pemphigoid. Question number 11. A child presented with a whitish lesion on the elbow and a penile shaft as shown in the image below. What is the diagnosis? A. Lichen planus, B. Scabies, C. Lichen nitidus, D. Lichen scroflosorum. इसका आंसर है Lichen nitidus. Lichen nitidus, the given clinical picture shows pinpoint to pinhead size, flesh colored with a flat, shiny surface. Papules are of lichen nitidus. It is an inflammatory skin disease that presents as localized, tiny, skin-colored bumps in children involving the flexor aspects of the forearm. Backs of hands, penis, chest, abdomen, and buttocks can also involve the face. Histopathological findings: discrete lymphohistiocytic infiltrate into expanding 1 to 4 dermal papillae. Epidermal colorate gives the classical ball and claw appearance. 90% of the cases. Multinucleated giant cells, foreign body or Totten type, often present overlying hyperkeratosis. With or without parakeratosis is seen. Basal layer, vacuolation, and colloid bodies may be prominent. Question number 12. A 45-year-old patient from Bihar presented with hyperpigmented macules over the neck. There is no hypoesthesia or nerve thickening, history of prolonged fever, and nodular lesions on the face in childhood. What is the most likely diagnosis? A. Atopic dermatitis, B. Tuberculosis, C. PKDL, D. Tuberculoid leprosy. इसका आंसर है C. PKDL. PKDL, based on the given information, the most likely diagnosis is PKDL post-Kala-Azar dermal leishmaniasis. PKDL is a dermatological manifestation that occurs as a sequel of Kala-Azar or visceral leishmaniasis, which is caused by a parasite transmitted by sandflies. Bihar is an endemic region for Kala-Azar. which increases the likelihood of PKDL diagnosis. The history of prolonged fever and nodular lesions on the face in childhood is also suggestive of a previous infection with visceral leishmaniasis. Features: it is present with hyperpigmented or erythematous macules, papules, nodules, or plaques, usually located on the neck, on the face, neck, arms, and trunks. The lesions may be itchy, but are usually painless, and there is no nerve thickening or hypoesthesia. Macular lesions on the legs, macular lesion on the legs. Question number 13. Identify the correct statement about leprosy if leprosy is untreated. A. Half of the people get their symptoms regressed spontaneously after bacilli exposure. B. Spontaneous remission is more common in children than adults. C. Indeterminate leprosy resolves more often than tuberculoid. D. Spontaneous remission not seen. Answer is C. Indeterminate leprosy resolve more often than tuberculoid. Indeterminate